morning to everybody.
Mercy, sir, you can hear.
I'm a homeopathic doctor from past 40 years practicing at Gandhi Bazaar. I'm more of a practitioner than an academician, though I was heading my council for almost 10 years as an executive member and board of governor from the last 3.5 years. And teaching medicine for 10 years in government college. Why I gave you this was, my contention would be more of the clinical data and clinical experience. I would recall the Abraham Lincoln who said, we judge ourselves what we feel capable of doing, but people judge us what we have already done. So in 40 years at least, I must have yes, if you ask me data, then today I was not given a chance to present my cases here, which I am ready as it is. I know lack of time. The question now was, when there is highway, why go in byway? That's the whole thing. When there is so much of modern medicine, when there is so much of volumes and volumes have been written about cancer, and where is the necessity of other things? That's what I told you. People are result oriented. If this system would have done wonders, nobody would have come to me. Suppose 7 to 8 patients in a day out of 100 whom I see, they are cancer patients. Unless you don't improve their quality of life. I'm not trying to tell you, of course, cause and cure, I don't know anybody can answer number one. And whether we know the causes of the disease, I would, I'm not trying to define myself in another way, just putting up data there and telling that this is it. No, there is something beyond that. Homeopathy believes man behind the disease is more important than the disease. We certainly don't treat, and I would recall a patient of Sloan Kettering Memorial Hospital whose bedside was kept, I have cancer. Cancer does not have me. That's the concept which homeopathy works with. It may look little out of the way for people who are thinking only at the level of the cell. And most of the chemotherapy cases, radiotherapy cases, I've seen after taking homeopathic medicines, they maintain their things. They have maintained their routine normal life, number one. Number two, then how do you assess them? And we assess them as a Karnofsky level, grade 100 to 10. 10 is almost serious, they have to admit. 100 is fine, normal. 80, 70, 60. After the treatment, where were they? After 3 months, where are they? And I can quote a immediate case made out of hemlock solution. By the way, the homeopathic basic principle is that which can cause can cure. That was the basic thing. In larger quantities, snake poison kills the people. Medium quantities, it paralyzes the people. The lowest quantities, it cures. The same thing works with homeopathy. And we have made a medicine out of cancer cell itself, known as carcinosin. The diseased potential individual, and I have seen all the, this is purely my clinical evidence. I have no other things to produce here right now at this level. 3 things totally I have seen with patients who come to me. The number one, 3 ready-made answers to all the patients when they go to a doctor. This is what they receive. The first dictum is, cancer is curable if detected early. Number 2, cancer is not curable, or cancer, if the truth is been told, it is detected when, it's almost on the last stage. So the question now is, detected early. How early is early? How late is late? All the patients who have every day gone to kidney cancer, last year they have gone, 6 months they have back gone, there was nothing. Suddenly from 1.5 months, where did it come from? Can we subject them to all the tests in this country where 1/3 population don't have one-time food? That doesn't mean that you should not go scientifically, no. But the question is, if you try to manage, as rightly Raghavendra Rao said, collaborating and integrative medicine, we can do wonders. Now, almost what homeopathy does is, homeopathy believes long before the tissue changes takes place in the body, there will be functional changes. We fail to understand that. Homeopathy identifies. If the truth is been told, cancer is curable if detected early. It is 100% truth as far as homeopathy is concerned, because it tries to identify the cancer diseased potential individual much before. Yen sir, one small boy hunge. I think if I tell you one or two sentences is Kannada, how many cannot understand, I don't know. But anyway, one simple, very simple thing she says, sir, one boy hundige iston susta, disproportionate prostration, loss of weight, anorexia, all these takes the totality of the symptoms irrespective of the cancer name, and we treat them. I have seen under the Karanofsky score, we have from 10 to we have reached up to 70, 80 for months, years together. I can quote all the cases with evidences. Now, the question, modern community accepts only the data, but much before the data, much before the tissue changes takes place, I think we should be able to identify which homeopathy does. I think I'll stop at this.
Now I'd like to have Dr. Prashant Shankar talk about his views on Ayurveda and cancer.
Thank you so much, Dr. Raghavendra. So my background, firstly I'll just describe my background. I'm an Ayurvedic doctor. I have done my master's in Ayurveda and I'm practicing for the last 12 years. I practice, just close by. We have the Institute of Ayurveda and Integrative Medicine, which is just next door. We have a 100-bed healthcare center, which was seeded by the Tata Trusts, and it's been about 12 years since the inception of the hospital. Now, so my area of interest and specialties, I deal with aging population, I deal with various conditions associated with aging, amongst which one of them is cancer. And I also happen to have the opportunity to be working with Dr. Raghavendra at HCG for some time and look at what was happening at that place, at HCG. Now, if I were to categorize the kind of conditions that come to our hospital seeking cancer care, I would say there are, we can classify these patients into different categories. There are people who come for primary prevention. They say that family member has a cancer and therefore what do we do to prevent? That's one category of, one subset of people who come to us. There's a second set of people who come for palliation, palliative care. So they're in stage 4 disease and they come to seek help to, for palliative care. That's a second subset of conditions that come to us. There's a third subset who come for adjunct. That is, they have finished primary treatment and then they come for, in between, what do we do? Can we do something more? That's the third subset of people who come to us. There's a fourth subset who come to us for side effects. They're undergoing chemo, radio, they have nausea, vomiting, hair loss, oral mucositis. So that's the other set of patients who come to us. So I would say these are 4 sort of sets of people who come to us at the health center. And so in the process, in the last 10 years, I think we have also learned as to what are the benefits and what are the limitations of different systems in dealing with these conditions. So we believe in integrative healthcare. I don't think that there's any one system. We have to rise above a system to be able to deliver patient-centric care, precision care. And that's our philosophy. And with that philosophy, we try and give patients care. And, so I can give you various anecdotes in terms of, so take oral mucositis, for instance. We have just started a small trial on oral mucositis where we are working with a cancer center in Indore. It's called Indore Head and Neck Cancer Center. And we have started, we have one arm which is going to receive Ayurveda care, and there's the other arm which will receive standard of care, and we're trying to see what is going to happen. And it is known that oral mucositis is quite a difficult symptom. Patients can drop out of treatment in the course of their chemotherapy or radiotherapy. And so this is one area that we are working on. And the pilot results are interesting because the intensity of fulminant mucositis gradually comes down with oral gargles as well as some internal herbs and medications. Right? So that's one interesting area. There are lots of patients with side effects. For example, radiation-induced proctitis. Lots of patients come with bleeding. They've been bleeding for 2 months, 3 months, and we've been working with some oncologists. And I can tell you recently there's a lady who had come to the OPD just last week, and we have been treating her for the last month or 2, and her bleeding stopped in a month or 2. Her oncologist called us and told us that, this is quite interesting, and So, there are things like that. There's another lady who had come to us just now with breast cancers, mets in the bone, mets in the brain, difficulty in walking. She came from Canada recently. And she stayed here for a month. She underwent yoga. So I think integrating yoga, acupuncture, Ayurveda all together to improve quality of life and measuring quality of life in palliative care is something that's, I think, has tremendous potential, because there's nothing for patients to do. They don't know what to do, and coming together for the sake of a patient's well-being is, I think, very important. And time again we have been observing. So now we have started a small pilot on documenting quality of life of patients. Every patient who comes into the hospital is being documented systematically with standard scales, and we'll have the data out in some time. So this is one more set of areas that we are trying to work on. Right, we have some trials going on with HCG on chemo brain. That's ongoing for the last few years now, and we'll look at the data soon enough. Right, so there are different areas that we look at, and I think there's a lot of scope there to integrate all of these systems. With that small background, I will stop. And maybe one more thing I'd like to say. There's talk about autophagy and how autophagy can be useful. Fasting, intermittent fasting is something that's becoming very interesting. I think I was listening to Siddharth Mukherjee some time back, and he was talking about environment is medicine. The environment of the human body is itself medicine. And I think, while diet, nutrition can play a very important role, panchakarma, that is the detox therapies that one undergoes in between chemotherapy, and standard of care, patients who are fit. We have been doing this for many patients. I think they can have a similar effect of intermittent fasting as well as autophagy in terms of what kind of impact they have on the immune system. And I think more detailed studies are required in that direction. So, there are lots of areas there's an area for clinical practice that goes on, but I think there's a lot of scope for research and documentation. And I think we must put effort to do that, to generate evidence so that it gets into guidelines. Thank you.
So now I'd like to request Dr. Amrita Ram to show some insights. He works in HCG hospital and handles the yoga department. So Dr. Amrita, you can just go ahead.
Very good morning to everyone. Basically, I was thinking, what more can I add beyond what has already been said? Just to touch upon a few things, I think three things. One, of course, there's an update on what is the current research that is happening at HCG with regard to the yoga studies that are happening. But before that, prior to that, I want to talk a little bit about the clinical setting and how everyone is now talking about integrating and multidisciplinary and joint approach and going beyond one particular system of medicine. And I think that is the way forward. We need to be able to be a lot more collaborative, be a lot more understanding that there is value in another system of evidence, another system of medicine also. And I think from a clinical standpoint, this is where we are at HCG, where we have a rehabilitation team which includes 7 departments across palliative, pain and palliative medicine, dental rehabilitation, speech and swallow, diet, nutrition, psycho-oncology, and along with yoga and yoga therapy, where we look at each individual case and try and contribute to the case to understand how, apart from cancer-directed treatment, we can contribute, we can add on to what can improve a patient's quality of life. Just to give one example of success of such an event was, there was osteosarcoma of the hip joint, and the patient was getting into surgery, but they realized that the respiration was not going to withstand the kind of surgery that was done. So the oncologist reached out to the yoga department and said, I'm going to give you 3 days, and that's the duration that I can wait before I do the surgery, and you can do yoga for him for up to 3 hours, 4 hours, 5 hours in the day. And as Raghavendra was saying, that yoga is not about something that you do with a headstand or a handstand, or you do a chakrasana or a wheel pose or a Adha Mukha Svanasana that is typically shown, like that is typically popularly understood. But we intensively looked at abdominal breathing, we intensively looked at doing full yogic breathing for this patient for a continuous period of time for those 3 days, and we realized that the oncologist came back and he said his respiration has improved quite well, his pulmonary function has improved quite well, and then we are happy to take him into surgery right now. So this happens through a rehabilitation team through a multidisciplinary process. So there are multiple occurrences like this where we look at what are the medical requirements, what are the ancillary requirements for a cancer patient to withstand cancer treatment, to prevent prophylactically, to look at how to manage the mind, and also in a survival phase where we look at reassuring the patients that keeping up a healthy lifestyle is going to help. So this was one element of MDT and a joint effort that needs to happen, and this needs to happen across not just integrative systems of medicine, but also with the conventional oncologists, as he was talking about this one. So just to give a very quick update on what is the current research that is happening. Prasanna already talked about the cognitive impairment during treatment that a patient undergoes, and we have a 3-arm study that is going on. One is looking at an Ayurveda intervention, one is looking at a yoga-based intervention during the treatment. So we look at what is not just the cognitive abilities in a non-invasive manner, but also we're looking at fMRI, we're looking at MRI-related changes that happens, and what are the effects of each individual cancer treatment. So this is a proper randomized controlled trial that is happening at HCG. We have, as Raghavendra was saying, we have a study with NCI that is coming up on the stem cell transplant patients, and we're looking at quality of life in a longitudinal manner, and to understand in preparation to stem cell transplant, we are going to be giving one arm, randomized arm yoga therapy and yoga practices that's going to help them with quality of life, with resilience, with better temperament in the mind to go through the entire treatment, because it's quite an arduous, quite a demanding, quite a tasking thing for a patient to undergo, and we are trying to look at this. So this is again a study that is going to be done across multi-centers, one of course in Houston in the MD Anderson Cancer Center, in Bangalore in our HCG Cancer Center, and also the HCG radiation unit in the BMT unit in Tanzania. So this is going to be one of its kind multi-centric stem cell transplant study that is happening. And I'd like to finish off by just making one point. We are all, I think modern medicine is also evolving to understand the value of real world data, right? And I'm a statistician at the core, so I understand that the modern medicine is also moving from randomized controlled trials to meta-analysis to Cochrane reviews, but now settling on to real world data. And real world data is what happens in the clinic. And I want to mention Dr. B.T. Rudrash's vast experience, the Ayurveda physician's vast experience that is there within the clinic. And we have always been talking about the variability in the data and where that variability comes from. And this is, and nowadays oncologists are now talking about, modern medicine is also now talking about what causes that variability, what causes that real world difference in how each patient responds, right? So we were at a phase before where we talked about cohorting people who are similar to each other, giving them one intervention and looking at what is the change. Whereas now we are talking about personalized medicine. We are talking about what is right for that one particular patient. And this has always been the Siddhanta of integrative Indian systems of medicines, where we have never looked at a cohort of individuals. We've always looked at what is the dosha, what is the prakriti, what is the individual capabilities, or what is the individual attributes of one individual patient, and tailor making the therapies to that one person. So I think this is a very bittersweet bringing together of evidence that is happening parallel to our the way we look at how we treat cancer patients. Thank you so much.
So the last, I would like to have Dr. Ravi Tippeswamy to give his views, because he sees a lot of patients day in and day out, and I'm sure he sees patients taking recourse to such treatments as well. So I want to elicit his opinions and what is his concerns on this, and what is the way forward.
Yeah, thank you, sir. I think way back when I was in Tata Hospital also about 12, 13 years back, there were randomized studies even at that time. Nowadays this integrated system is very important, and we as an allopathic doctors or medical oncologists, now we don't dismiss any suggestions given by our colleagues. So that is one thing what we are looking, and even what we are using for low platelets, this caripil, say curcumin in oral mucositis, these are all from their medicines. So I think now the integration has already started, and people are realizing the fallacies of each system, and it's an integrated system. We should come together. Only thing what I think Dr. Agmani sir also suggested is coming together and producing the data. I think that's what we are lacking. So probably if you produce good evidence, that real world evidence is sufficient, not randomized studies. If you collaborate and publish this data, I think the world will accept more the integrated system. And to quote, all our cancer chemotherapy medicines, majority, they are all from say herbs or some animal derived. So they are not synthesized. So that itself suggests that probably if we give it in a right dose, right proportion, I think any drug will work. So this integration and producing real world evidence is very important. In day-to-day practice now, what we are using these, especially these Ayurveda, yoga, respiratory techniques, meditation, especially rehabilitation when it comes to any breast cancer patient, lymphedema, management. When we talk about any orthopedic procedures, say rehabilitation, and especially this yoga, it plays a very important role. So I think it's already integrated. Only thing is we have to probably for each and every patient we have to have a joint meeting and see that what best can be done for that patient. I think with that I'll conclude.
Thank you, Dr. Ravi Swami. So what is important here is the need of the year is to have a multidisciplinary approach to a problem. So at the end of the day, we are trying to solve the patient's problem. So there is a problem, and the patient has pain. The pain is not going even with chemo, or with your painkillers or with morphine. What can be done to assuage the patient? How can you reduce the distress? End of the line, that's what matters, I think so, because that's where I think we should draw the line. Rather than talking about having Ayush to have to promise cures for the patient, if we can work on this side of the patient where we can improve quality of life, reduce symptoms, manage symptoms effectively, and as well as reduce the distress. And that should be the way forward, where we can really integrate Ayush to improve the patients with cancer and make their lives better. So in the end, I thank you all for a patient hearing.